So, you've been diagnosed with deep vein thrombosis, also known as DVT. This condition occurs when a blood clot forms in the veins of your legs, which can be quite dangerous for your health. You may be wondering what steps you can take to prevent the clot from worsening, or how to handle it if it returns. One potential treatment option to consider is the use of stents. Stents are small metal mesh tubes that are used to keep narrowed or blocked blood vessels open, allowing blood to flow smoothly. You may be familiar with stents being used to treat heart attacks caused by blocked arteries, but they are also used in the treatment of deep vein thrombosis, DVT. Venous stents function similarly to those used in heart attacks, but are specifically designed for the needs of your veins. The FDA has approved several stents for this purpose, including Abra, Venovo, Vichy, Venous Wall Stent, and Zilver Vena. When dealing with DVT, the first line of treatment is usually anticoagulation, which helps reduce the risk of clotting. This medication, also known as blood thinners, can be taken orally or through an IV. In more severe cases, the clot may need to be dissolved or surgically removed. In some cases, stents are used as an additional treatment to provide physical support to the vessel walls, allowing for better blood flow. After the clot has been dissolved or removed, your doctor may notice that the vein is still narrow, a condition known as stenosis. This narrowing may have contributed to the development of DVT in the first place. Stents can help keep these areas open and provide support in veins that have scar tissue from long-term blockages. It's important to note that 20% to 50% of people with DVT may develop post-thrombotic syndrome, PTS, which can lead to symptoms such as leg swelling, venous ulcers, and debilitating leg pain. Stents can help alleviate these symptoms and improve your quality of life, making it easier to carry out daily activities. So, if you and your healthcare team decide that a stent might be a good option for you, the next step is to learn more about your blood vessels and clot. This can be done through imaging tests. The most common test is duplex ultrasound, which uses high-frequency sound waves to take a picture of your blood vessels. It can show how your blood flows in your veins and in which direction it's flowing. All of these details will help your doctor know the exact spot where your veins are narrowed or blocked. Ultrasound has no known risks and doesn't use radiation. You won't have to do much ahead of time to prepare for this test, though your doctor may ask you to avoid eating or drinking for a few hours beforehand. First, the ultrasound technologist will apply gel to the surface of your skin. Then they will use a handheld wand, called a transducer, to send sounds into your body and measure how they bounce back. Venography is another option, used when veins are in a place where it's hard to get a good look using ultrasound. The exam, also known as a venogram, is an X-ray. Like ultrasound, it will help your doctor learn more about how your veins are shaped. A doctor will insert a thin tube, called a catheter, through the surface of your leg into your vein. Then they inject dye into the catheter. This special liquid is what allows the X-ray to capture images of your vein. In some cases, your vascular surgeon may choose to diagnose and treat your DVT at the same time. Venography can be used to guide stent placement. With X-rays, there is a small amount of radiation involved. So your doctor will want to know if there is any chance you might be pregnant. You'll also need to discuss whether you are allergic to the contrast dye used. You might need to avoid eating or drinking anything in the hours before the test. The stent placement for DVT is usually done as an outpatient procedure, meaning you won't need to stay in the hospital. You'll only need mild sedation, not general anesthesia. First, your doctor will use a balloon angioplasty to clear any blockage in your vein. They will insert a needle into your skin to reach your vein, then use various tools to guide the catheter to the right place, with the help of X-ray images. A tiny balloon on the catheter tip will be inflated and deflated to widen your narrowed vein. Then, a different catheter will be inserted to place the stent in your vein and allow it to expand. After the stent is in place, the catheter will be removed and pressure will be applied to your skin to encourage the wound to close and prevent bleeding. You won't need stitches, but your skin will likely be covered with a bandage. After some time to recover, you can go home the same day. Stents are being used more often for DVT cases caused by blocked or narrowed arteries. Early evidence suggests that they are effective, with one study showing that patients who had a stent inserted after clot removal were less likely to have their DVT return. It's important to note that the success of the procedure is higher when the clot is completely removed and blood flow is restored before stenting. This increases the likelihood of the stent remaining open in the long term, with a 84% to 90% chance of the vein staying open 1 year after receiving a stent. When it comes to venous stent placement for DVT, it's important to be aware of potential risks. Some of these risks include stents not expanding fully in the blood vessel, not staying in place, or breaking. In rare cases, the catheter used during the procedure could cause damage to the blood vessel, leading to bleeding or infection. It's also important to note that some people may be allergic to the dye used during the procedure. And there's also the possibility of the blood clot returning. Once the stent is placed, you will need to rest for several hours at the hospital or clinic. This is to ensure that early complications can be monitored by your healthcare team. You will also be given a prescription for an antiplatelet drug and will need to take aspirin to prevent blood clots from forming on the stent. Your doctor will provide specific instructions on how to care for the puncture site where the catheter entered your skin. It's important to ask your doctor about safe movements and exercises for your recovery, as it will take about a week to fully recover from the procedure.